Okay, thank you everyone for joining us. So we're right at 12:30, so we'll go ahead and get started. So welcome everyone. Thank you for joining us today. My name is Rachel House and I work for Primary Care Development Corporation or PCDC, and we are excited to share with you our webinar series from Blueprints to Breaking Ground: Capital Planning for Health Center Growth. So this is the first of three sessions that will provide an overview of the process and key considerations before embarking on a capital project. And our goal is to empower health center leaders with the knowledge and tools to engage in successful capital project planning, sourcing, and implementation. So whether you're in the early stages of planning or are currently navigating the complexities of project financing, this webinar series will provide you with critical insights and best practices for success. So we encourage you to use the Q&A and chat to ask questions throughout the presentation. We'll be monitoring the chat, and we'll also have the opportunity for questions and discussion at the end. This presentation will be recorded, and we will be sharing the slides and the recording with you following the presentation. So those that may not be familiar with PCDC, the Primary Care Development Corporation supports healthy, thriving communities across the country through primary care transformation, investment, and advocacy. So we're on a mission to expand access to equitable, high quality primary care in communities that need it most. Nancy, did you want to say something? No. Okay. All right. So in our over 30-year history, we've leveraged more than 1.7 billion on health center projects nationwide, and we've helped over 1,300 practices transform into medical homes. So our investment team works with borrowers to craft financing solutions that work best for them and on developing lasting relationships to help repeat borrowers achieve their long-term growth plans. And our consulting and training team partners with health centers and primary care practices to transform and sustain their operations by optimizing their care models and strengthening their financial health. So again, my name is Rachel House, and I'm a senior program manager on the consulting and training team. And we'll also hear from my colleagues Maya Morse and Nancy Lager, who have a wealth of experience working with health centers. So I'm excited for them to share some of that experience with you today. Maya is a director in our consulting and training team, and she joined PCDC in 2012 and has led quality improvement efforts in federally qualified health centers, independent practices, and hospital ambulatory settings to improve patient access and quality. She specializes in care model optimization, quality improvement, PCMH certification, and value based care models. And Nancy is a senior director from our capital investment team. Since joining PCDC over 20 years ago, Nancy has advised health centers nationwide on project development, financing, and underwriting loans to promote all stages of facility development. So for today's session, we'll want to accomplish three key learning objectives or takeaways. We want to first emphasize the connection between planning for a capital project and your organization's long-term goals, as reflected in your strategic plan. Ultimately, capital projects are resource and time intensive, so it's critical that there's alignment between the planning process and your organization's strategic planning agenda. Second, we want to build a framework to help you assess capital development needs. This is the analysis that will inform your organization's project planning process and serve as a business case for your capital project plan. And finally, we'll review the key steps in capital project planning. So this is the process that establishes your work plan, budget, and timeline so that you're well set up and prepared for executing your project. So, our agenda for today will cover first the goal setting process, which again includes strategic planning and pre project analysis. This is a crucial step, again, as it provides a business case for your capital project and really helps you understand why you're pursuing a capital project and what you want to accomplish. And in part two, we'll review the components of capital project planning. So these are all the elements that make a project come to life, including creating the work plan, project team formation, program and space planning, and project budget development. So before we dive in, we wanted to start off by getting a better sense of who's on the call with us today. We have two brief polls. First, we'd like to get a sense of the capital development experience on the call. So please rate your current knowledge, and the poll should be coming up shortly. Please rate your current knowledge and experience with capital project planning. And then we have one additional question, which is to get a sense of, the stage of where your organization is in the process. So if you're currently have a project underway, you're thinking about one, or maybe you're not currently planning a capital project at the moment. Give everyone a minute to finish those polls. Okay, so looks like for question one, a lot of people are intermediate, the majority, about 50%. We have a few, about 25% limited experience, and another 25% are advanced. So a wide range of experience. And I think we'll have some good information for everyone, regardless of your previous experience. And then can we show, oh, and then if we scroll down, so your organization in the process, so we have quite a few people 2 to 3 years out, about 25%, another 44% in the next 6 to 18 months, so more current. And then we have about 19% who have a project underway. So, and then 13% who are not currently planning. So again, a wide breadth of timing here. So we will have something for everyone. I look forward to sharing more with you. So let's move on. Thank you for completing the poll. Okay, so first and foremost, what is capital planning? So health centers rely on capital investment to sustain and expand services to underserved populations and communities. And capital planning involves evaluating the funding needed to support your organization's future growth. And this series will focus on specifically capital project planning rather than working capital, which is used for more day-to-day operations. So capital projects, there's a wide variety of what capital projects could be. Um, it's large investment of cash to fund these different types of projects. So for example, it could be purchasing land or building. It could also be purchasing an existing or acquiring an existing practice, also new construction, renovations to existing sites, which may be to accommodate expansion of services or capacity or addition of new services. And it can also be things like energy efficiency upgrades or upgrades to IT technology. So lots of different types of capital projects. And over the course of the 3 sessions, we will cover the key steps of the capital project planning process that again begins with strategic planning and commences with the closing and construction process. And today's session will focus on the pre-project analysis, as we mentioned. So that's the core preparatory work needed for capital projects, as well as the capital project planning process itself. So we'll focus on those first two foundational steps. And now I will pass it on to my colleague Maya to talk about strategic planning.
Great. Thank you so much, Rachel. Hi, everyone. I'm Maya. I'm happy to be here. So as Rachel mentioned, I want to talk a little bit about strategic planning and some of the pre-project analysis that we want to do. And as we begin, I want to think about as we begin thinking about a possible capital project, it's really important for me to mention that setting sites on a particular property or location is probably not the best way. It's not really the first step in planning our project. Unfortunately, what that often leads to is making what you need fit rather than finding something that really fits your needs. So instead, we like to start with establishing a strategic plan and making that the foundation of our capital projects. And the reason for this is that it helps us set out the short and the long-term trajectory for our organization as a whole and see how maintaining an existing facility and whether we want to change or potentially grow, and the extent to which we might want to change and grow, and what sort of capital we would need to do this. So this is really where we like to begin our work. Next slide. Okay, so the strategic plan is really the process of setting goals and objectives to inform the decisions that we want to make for our organization. These are short-term, these are also long-term direction for the organization. And this is really the roadmap. The truth is, it's the roadmap for all of our work. So we're thinking about our quality metrics, the programs we're participating in, but also the trajectory of the growth of our organization. And if we do see a lot of growth coming, then we need to start thinking about how we might meet that need. This process is a fairly expansive process. It typically involves our board, our executive leaders, and often our frontline staff and all of our and some of our patients as well. There are a lot of resources that you can use. We actually provided a few links to the right here. These are all from the National Association for Community Health Centers. They have some great resources that you can use if you're just starting on your strategic plan, or even if you've had it for a while and you need to sort of revamp, there is a great place to look as well. But when we work with organizations to do some strategic planning, we like to conduct a SWOT analysis. So really lay out the organization's strengths, weaknesses, opportunities, and possible threats. And the goal here is to think about the next 3 to 5 years, because that's what really the true sort of trajectory of a typical capital project. Sometimes we need to start thinking several years before it's actually going to happen. Next. Another really important piece is to do an external assessment. So federally qualified health centers are required by HRSA to do an external assessment, a needs assessment every 3 years. And so this helps to identify the needs of the health center's patient population and the community sort of as a whole in the surrounding area that are using the potential services of the health center. And so this needs assessment is honestly, it's very comprehensive. It includes quantitative data and qualitative data that may be available, and is really supposed to inform our strategic plan in terms of how our organization may need to grow to meet the existing need in the community. And I would say that this needs assessment is as important as it's ever been. It's increasingly more important because there is so much more emphasis on some of the non-medical needs of our patients, which will be included in this needs assessment. And all of our relationships with community-based organizations should be part of what's falling into this needs assessment content. So it also helps us to evaluate our current service area. You can review your own current service area through the UDS mapper. That is, you can see the link right there. And then there's also, again, really great guides through the National Association of Community Health Centers around the content of a needs assessment and how to have that done. Okay, next slide. Okay, so in terms of that's really the external assessment. So that's everything that's sort of happening. The needs assessment is happening outside of our organization and looking at the external community. It's also really important to think about some of the internal assessments that we can do that might inform our plan over the next few years and whether or not we need to grow and expand. And so we like to do an operational assessment before we begin any uh, capital project to really get a sense of how we are performing now. So one of the first areas we like to look at is productivity trends. And this is really important. I know it can be a little bit of a touchy subject at some organizations, but looking at productivity helps us analyze our current patient volume and our projected future growth. This also helps us think a little bit about any additional services or capacity that might need to meet our community needs. So that's, really cross-referencing our needs assessment and seeing, are there different types of providers or services that we are not actually providing at this time that we will need to. Productivity, I will talk about that in a little bit because we do have a great access metric we like to use to analyze that. But it is a very important piece of our operational assessment. Additionally, of course, we have to look at staffing. Staffing really was challenged during COVID-19. I think it still is. Certainly hiring some staff and providers, particularly when you're in more rural areas, is very challenging. But thinking about our staffing model and estimating the staff needs based on any increased capacity or new services is very important. We need to determine whether the health center can recruit, train, and retain a necessary workforce if we do expand. Financial performance is really critical to any capital project. So we like to evaluate financial performance under the current operating model. So if the organization is currently facing some financial difficulties, consider whether disruptions from construction and any ramp ups would exacerbate that strain. It's important to ensure that we have strong billing and collections processes in place. Certainly, if we don't, then it's very likely that we could bring over some of those bad habits to a new practice or an expanded environment. So we like to look at some specific reports, days in accounts receivable, billing and collections, days of cash on hand, our operating margin, debt to equity. Those are just some of the financial metrics that we like to look at that are all really helpful to give us a sense of what our current operating model, how it is performing. And then finally, there are several access metrics that are very relevant when we're thinking about possible growth of our organization. And this is where we want to assess our supply and our demand when it comes to access. Next slide. So that brings us into what is demand. So in order to look at access in general, it's really critical that we get a sense of what is the true demand for services and what is our capacity to provide those services. So when we think about demand, it really reflects the need for services by a panel of patients. So this includes clinical care, referrals, advice, condition monitoring, also some behavioral health or any other integrated services that we might be providing on site. Many of you may be providing dental services. Any prescriptions, forms, and results that may be using some of our staff, often a lot of nursing staff, but also sometimes provider staff as well. To get those tasks completed. And then also our self-management support and education, which cannot be overlooked and will likely only be increasing in the years to come as there's much greater emphasis on some of our value-based care programming. When we think about demand, we have to think about two different types of demand. We have patient-generated demand, which is mostly everything I just mentioned. But we can't discount some of the provider-generated demand, which is essentially when we have a provider asking that a patient be scheduled perhaps in 2 weeks, maybe in 4 weeks for a follow-up appointment. And typically that appointment is put directly into the schedule, even if it might go against some of our scheduling rules. So make sure we're accounting for both when we think about our demand for services. And once we do that, you can go to the next slide. We really have to look at our capacity. So our capacity is our ability to actually accommodate that demand for services. And so This includes appropriately triaging and matching our time slots to our appointment types. That is a very simple statement to say. It is much more challenging to do in practice. We want to make sure we're distributing the work among the care team. This is ever evolving, even with the best workflows and a lot of conscious discussion around it. It is always very hard to make sure that everybody is sort of working to the top of their license, so to speak, and that we are really appropriately distributing the work among our team members. It's important that we have the knowledge and relationships with external partners. Again, in many states, this is becoming much more of a focus for those of us that are working with an 1115 waiver. The relationship with not just our specialists, but our community-based organizations is critical, and making sure that that's not all held by just one individual or the provider. And then we're finding that care continues to be provided in many different ways, sometimes through virtual care, sometimes through through group settings, and that trend will probably continue to happen. Ultimately, we do need to make sure that we have the adequate space and facilities to accommodate that demand, as well as the various types of staff to meet the demand. Okay, next slide. Okay, and so then there are a few access metrics. Many of you have heard of these access metrics and hopefully are looking at them regularly. But again, they're very helpful for us to make the business case for or against a capital project. So provider capacity utilized really considers how many provider appointment slots result in completed visits with patients. So essentially, if a provider was asked to has the actual appointment slots for 20 different appointments and then ultimately sees 10 patients that day, then they would have a 50% provider capacity used, right? And essentially there would be 10 slots that were unused. Now, perhaps they were initially booked at the beginning of the day, perhaps patients no-showed, there were some cancellations, maybe there were some walk-ins, so that helped to account for some of the used slots. But at the end of the day, about half the available slots were used. So getting a sense of whatever available slots are sort of sitting there unused will help us know if we're sort of fully maxed out or if there is some room for us to accommodate more patients. I would say the key here is to actually set realistic expectations for the number of appointments that we want to see today. If there are 20 slots on a schedule, but we actually only expect the providers to see 12 patients, then thinking through that so that we're not sort of inflating or unnecessarily inflating what that number should look like. Another great report is third next available appointment. And I know that this is a metric with a lot of question marks around it. So it's actually quite simple. It basically says that if I was a patient that wanted to be seen today, when is the third next available appointment on my clinician's schedule? And the reason you might ask, the reason why we're not looking at the first available appointment, but instead drawing a line in the sand with the third available appointment is that really those first two appointments on the schedule might be a fluke. So I'm calling in today, maybe tomorrow there's a same day appointment available. It's an open slot, but I can't use it because that doesn't open up until tomorrow. There also could have been a recent cancellation, but I'm not going to be able to come because, the cancellation just happened and it's going to take me to get there. So instead, we like to look at the third next available slot and then just count out the days. So today is a Wednesday. The third next available slot is on Friday. So that is 2 days from now. So it would be the answer for my third next available appointment is 2. If instead it's on a Monday, then actually it's 5 and you might ask, well, the practice is not open, so why are we counting the weekend? We're counting the weekend because it's another day that the patient is waiting. So what's ideal here for third next available appointment? We really want the third next available appointment to be at least within 3 weeks from now, because if it's not, then that's all time that the patient is waiting to be seen. And if it is urgent, then hopefully within 24 hours. I know that this is easier achieved or easier said than achieved at sometimes. This is absolutely a report that needs to be run by provider. Just looking at your organizational numbers is really not going to inform what the true availability is by provider. And you may find enormous variation in this number based on whether it's a more senior provider or if it's somebody that more recently started. And then next is cycle time. So this is cycle time always looks at the complete time that a patient is in the practice, from when they arrive to when they leave. That is a little bit more nuanced because at a community health center, we're often providing more services than at a typical primary care practice. So I'm actually okay increasing the cycle time with the assumption that there are more services at a community health center. So I usually sort of make the goal maybe more like 60 minutes or maybe even up to an hour and 15 minutes for a community health center. The key when you're looking at cycle time is to actually do an in-person monitoring so you can isolate the idle time. Idle time is time that the patient is sitting in a wait room or sitting in an exam room, just waiting to be seen. Honestly, that is the time you want to minimize, not the time, the active time with a clinician, with a nurse, with a staff member. It's really that idle time that frustrates patients and is less necessary. So those are three really good measures to give you a sense of how you're operating. Next slide. And please jump in if you have any questions. Okay, and so then if you've done all that external assessment and internal assessment, perhaps you do come to the conclusion that expansion is the informed decision. So there are ways that we can expand without a capital project. So certainly increasing provider capacity is an option. And so, perhaps we just want to hire more providers or we want to use providers in different ways. And so that might include extending hours during the evenings or weekends. If that's not something that your clinicians are interested in because, perhaps they're salaried and you can't really add on more hours, you could consider using moonlight providers, which is actually something I did when I worked at a community health center. We hired some providers from the community who had regular evenings during the week that they came to our health center, and they had panels of patients associated with them. This filled a huge need for us in terms of filling some of the capacity for our patients, and also allowed for a continuity that was equally important for our patient population. And then there are also ways to acquire existing provider practices in the community that do not require a huge exchange of money. And so if you have more questions about that, please contact us. We can talk about how that might work. But it is an option for some groups that need some more capacity, but don't necessarily want to engage in a capital project. And then if you do want to engage in a capital project because none of these other options work for you, then there's basically three options. We can renovate our existing facility to allow for more capacity. We can expand an existing facility, or we can develop a new practice location. And with that, I'm going to pass the baton to Nancy Lager, who will talk about project planning.
Thank you, Maya and Rachel, and thank you all for being here today. So assuming, as Maya said, that your needs assessments do point you to a facility development project, project planning is the stage where you prepare your roadmap, you set out all of the things you'll address and a time frame for accomplishing them. We do only have a very short time today, so we can only really whet your appetite on this, but do hope that you come away with a high level of understanding of what it takes to at least start a capital project, or rather start planning for the capital project. So there are three watchwords that we'd like you to take away from this presentation. Those are sustainability, realism, and flexibility. And for the good of your organization, please don't bite off more than you can chew and don't swallow any pits. So next slide, please. Project planning is the first stage in the development process. And as noted in the graphic on this slide, this is when you put together the work plan, you assemble the initial team members to set out the scope of what you want to accomplish, and you put together a preliminary budget. In the upcoming 2 webinars, we'll touch on the later stages. And you might want to consider reading about or refreshing, for those of you who have more experience doing capital projects, you might want to refresh that understanding of the full development process. There are many resources available on the internet, including a guide that PCDC prepared and which is on our website. And we're happy to send that link if that's of interest, or point you to where it is on our site. Next slide, please. So creating the work plan. This is literally the roadmap to getting to and through construction. It's where you set out the stages and the tasks, including identifying when you should bring on external consultants, when you should secure property, and when you need to accomplish different development tasks in order to meet your desired project timeframe. I want to really point out that realism is key here. You do need to be realistic in the sense of your own ability to focus on the project while you're also doing your day job running a health center. You need to be realistic about the expertise you have in-house and the process and timing for engaging outside experts. And you need to be realistic about securing property, whether you plan to lease or purchase. And finally, you need to be realistic about your ability to raise the funds needed to undertake the project. Next slide. So first, the first step in assembling the project team is identifying the internal staff who will help guide the project's development, pulling together the group who will be tasked with formulating the scope and determining who the key decision maker will be. So it's been our experience that owners can waste a lot of time and money by not being in a position to differentiate good decisions from bad ones. So really coming to understand the knowledge and experience that your own staff bring to the project in terms of both facility development and operations understanding, is the important first step in determining then the kind of external expertise that may be needed to fill gaps. In any capital project, a few external consultants are essential. And that is really because it's unlikely a health center has on staff people who have capabilities like space planning and architectural and engineering, or the kind of expertise that a design build firm has. So at a minimum, you're going to engage those people, the primary players shown on this outside of the owner on the slide. Now, while you may have a facilities manager on staff, and so you believe you don't need to hire a project manager, you should think through this carefully. Based on my experience, it's rare that the facilities manager or another staff member has the array of skills or the time that is needed to manage a building project rather, and more so one that is especially complex. So we often suggest that health centers hire an outside project manager, one who knows development, who's detail-oriented, is available to spend time on your project, and is both assertive and diplomatic enough to manage the entire project team, including you, the owner. So this is also the person who is key to refining the project work plan. And I'll just end with, a good project manager is not a luxury or a cost that is not well spent. Next slide. In setting out the program plan, you'll start at a high level, first being clear on the goals you're trying to accomplish, the services you plan to offer, and whether you're going to include space for complementary uses by other organizations or businesses. In the space plan, then, you detail the number and kind of individual rooms that you'll need for each service you plan to offer, and the space for administrative and staff-only functions. The amount of space in each type of room will be predicated on the kind of equipment that goes into that room, how you like to operate, and any regulatory requirements you need to meet. So engaging a space planner is important because that person can bring the understanding of all of those drivers to the process and setting out the kind and amount of space you need. If you're thinking about replacing the existing center, this is your chance to redress existing facility constraints. For example, arranging spaces within the new facility differently so that you can establish or improve team-based care, or increase the ratio of exam rooms to providers to help with productivity, as Maya discussed, or simply to improve the patient flow through the course of the visit. If you plan to build an entirely new site, also as Maya noted, this is a good time to rethink how you operate so you don't recreate the same unoptimal practices in the new location. We do encourage you to reach out to other health centers who've done recent projects, and if you can, consider visiting some of them. It's helpful to talk through with them what they did well, what they felt they did wrong, and to learn from that. And it's especially useful if you plan to establish a new service that you haven't provided before. Next slide, please. So the initial project budget should detail all of the costs that you are likely to incur in developing the project. This includes the more obvious ones like construction and equipment costs, and the often overlooked ones like environmental testing, contingencies, and potential financing costs. And at the end of each stage of the design process, which we'll discuss in the next session, as the level of specificity increases, the project budget should be updated. We do offer clients a project budget template that really helps remind them of all the kinds of costs that they might incur. Now, when you put together the initial space program and space plans, you may start out planning your dream project. Then, when you prepare and continue to define the project and your project budget, your ultimate decisions will be guided by that realism and sustainability, as well as flexibility. Can you raise the funds to pay for the dream project? Can you raise them in a realistic time frame? You should note that we are still contending with the rise in construction costs and supply chain disruptions that occurred during COVID. So you might find as you get cost estimates from outside contractors that things are costing more than you had hoped. So you then need to start preparing, or rather adjusting your expectations to find a more affordable balance, say between providing high need, high demand services, those that are likely to produce more revenue, and things that you might like to have, such as space that you might want to make available to the community. You may not be able to accomplish those all at once, so you could consider dividing the project into phases that can be undertaken sequentially as you set aside additional cash reserves and continue fundraising. It's a way of getting something started, getting some of the project done, new services started, maybe not accomplishing the whole thing at once, but can be, again, a more realistic approach. Next slide, please. These are then examples of how project planning is iterative. The fact that you need flexibility, you need to be more realistic, make harder choices perhaps as the design process progresses towards the start of construction. As your details become clearer, as the project budget perhaps increases beyond what you had anticipated, and you need to consider refining the budget and the project as a whole. There can also be hiccups that result in the project or aspects of the project needing to be rethought. Again, an example of being iterative. With sufficient due diligence, many of these can be minimized. Some of them you can't account for. It's possible your seller changes his or her mind and takes the site off the market, and you have to find a new site after you may have done a lot of that program and space planning work. That happens. But there are ones that are in your control, and where, you know, if you've done enough due diligence, as we've seen other health centers encounter later in the process, if you do things enough up front, you might minimize those disruptions. Just two examples for when you're acquiring property. We did have a recent example of a health center that commissioned what's known as a phase 1 environmental assessment. But then there were recommendations in that to do additional testing, and they did not do that, and instead proceeded with the project and started construction. Now they're having to do that second assessment, in part based on their lender's requirements. And if there is remediation that is needed, they're going to not only face an increase in their budget, but also a potential disruption of their construction process. So good to do those things up front and avoid an eventuality like that. In addition, again, when you're buying property, health centers sometimes do, sometimes don't think about doing an appraisal. We do highly recommend it. In part, it can help you with the negotiations with the seller. The seller may have an unrealistic price they've put forward, and when an appraisal is done, you might be able to negotiate the price down. It's also needed, though, for when you intend to borrow money to complete the project, because lenders often set or limit rather the amount of the loan based on the appraised value. We had a recent example where the appraisal came in lower than expected. It meant that the health center could not borrow as much money as they expected, and now they're searching for other ways to fill the funding gap. So I think that takes me to the end of my section. Again, I hope that you will come back for the next webinar and the third one after that, where we'll have more information on the development process, project financing, and some lessons to be learned from your colleague, fellow health centers. Thank you.
Thank you, Nancy and Maya, for very informative sections, and a lot of good information here. So a couple key takeaways that we want to just highlight here. So again, it's critical to set clear goals and understand why you are pursuing a capital project and what type of capital project you need to accommodate your goals. Again, ensure alignment with your needs assessment and your strategic planning process. Those need to really be in lockstep to ensure, long-term success. And then before buying a property or seeking funding, it's important to set up a project team and create that preliminary work plan and space plan and budget. So having that information ready before you go out to seek funding will really set you up for success. And then, as Nancy mentioned, just to kind of build in the assumption that things will not go exactly as planned. So we need to allow for flexibility, both in the budget and in the timeline, and some of your ramp up assumptions. So plan on things not going as planned. And then really, no matter where you are in the process, PCDC is here to support you and has lots of different resources. So whether you're in kind of the early assessment phase, thinking about a project, assessing your operations and capacity, or whether you're farther along in the process and you have a project and you're looking for funding, we are happy to help and provide you with additional resources. There was a question in the Q&A. We will be sending the slides. There's a link to that guide that Nancy mentioned in the slides, and so we'll make sure you have access to that information. Additionally, we want to just remind you of our upcoming sessions. So again, this is part of a series, and really to get the full picture, we encourage you to attend all 3 sessions. So we have a QR code you can scan. We will also be dropping the link to registration in the chat. So please do that. The second session will be on November 13th, and it will be really focusing on funding sources And so we'll get into the details of different funding sources available and also looking at loan eligibility requirements. This will include some sample calculations for determining sort of your loan size. So lots of great information in that session. And then our final session will be on December 11th. And this is where we'll talk about some of lessons learned about project implementation. Again, we've worked with so many health centers. So we have seen a lot of different things, what works well, and maybe some challenges to avoid. And that will be a discussion with a panel of other health center leaders. So we encourage you to attend that session as well, to get lots of good information. And so that is the conclusion of our presentation today. Feel free, if you have any questions, to come off mute or drop them in the chat. If you have any specific questions for Nancy or Maya, we'd be happy to answer those now.
So folks actually don't have the ability at the moment to come off mute, but if you would like to, just indicate in the chat and we can open up your lines for that.
Okay, or feel free to drop your questions in the chat. And if not, we look forward to seeing you at our next session. So thank you all for attending today. And we'll stick around if you have questions. Otherwise, feel free to drop off.